You're listening to The Business of Healthcare. It's July 28th, 2017, and this programming is directed to patients and providers alike. The healthcare reimbursement world has really changed. So the question I pose to you, the listener, what changes do you need to embrace to make the best use of the current system? If you're a patient, you used to just need to arm yourself with medical-related questions when you prepared to see a medical practitioner. Well, today, you almost need to treat it more like a meeting with your accountant, attorney, and financial planner all rolled up into one. If you're a medical practitioner, you just used to have to dig out your best bedside manner and both the most current and tried and true medical practices, and you were ready to see your patients. Well, today you're almost in the same boat as your patients. You need to be thinking like your accountant, your attorney, and a game show host contestant, since so many patients come in throwing you curveballs that have been lobbed by their brother-in-law, who's a physician's assistant, the television talk shows, and WebMD. So, and especially today, right? They really are a lot of changes going on. So, and the worst part is we don't know what's going to happen. So, the best that we can do is try to figure out how can we manage best with the system that we've got today. And hopefully my two guests that are joining me today will help further that along. We'll be discussing a couple different areas of the business of healthcare, and as usual, we'll intersperse the talk with some nice afternoon music. So we're going to be talking about understanding the business processes of a medical practice. Now, as a patient, it can be helpful to try to understand why they do some of the things they do when you're interacting with a medical practice. And if you're a provider, you might learn something about your own business practices. So my guest today, my first guest, is Stephen Peltz. He's the principal at Peltz Practice Management and Consulting Services, LLC. And as always, if you want contact information for any of my guests, you can find that on our playlist at wusb.fm. Stephen enjoys solving problems, and he learned that almost every business is process dependent. He identified the process from the first call that a patient makes to when the check clears, and he finds disconnects in a medical practice. And what he works to do is to teach the staff in the process how to make the whole thing work more smoothly. So while more than half of his clients are in the medical or dental field, he does also work with non-medical clients, including a construction company, a hardware support and maintenance company, and some others. So, Stephen, let me welcome you now to the business of healthcare.
Well, thank you very much. Good morning, good afternoon. It's always morning somewhere, to paraphrase Jimmy Buffett. And I want to thank you very much for inviting me and wish you and your listeners a happy Friday and a good weekend. And it has been a pleasure working with you, Habanero, over the past few years, and I have learned a lot from you. In addition, even though you're involved in a very complicated area of healthcare, you still love rock and roll.
You know, that's true. I definitely do. And ska and reggae and classical, that's one of the things that I love about being a part of WUSB is you don't get pigeoned into a genre. And our little saying here is, if you don't like what you're hearing, tune back in 2 hours. It'll probably be something completely different. So, Stephen, as I was putting together some of your information, I see that you graduated from the Southampton College of Long Island University, and you say that it's no longer there.
That's correct.
Well, that's actually not quite true, because
actually Stony Brook took it over.
Yes,
because they like the oceanographic part of what was part of Southampton College.
Yeah, so the School of Marine and Atmospheric Sciences is stationed there. And I, in my previous life, when I did my morning show, Whatever Floats Your Boat, I often had SOMAS students on doing weather and all kinds of other reporting, and some of their professors. So it may not be LIU any longer, but it's still an important part of education here on Long Island.
Yes. In fact, I was part of the first class at Southampton College. We are celebrating our 50th anniversary this year. We've been together many, many years, and we meet, and it's amazing to me the experience that we went through there, because when you're the first class in anything, nothing is in place. There are no upperclassmen to tell you what to do. You create your own precedents. You create your own history of what goes on there, and it was so much fun.
That's kind of how I feel right here today with this brand new studio. This is, I think, probably the first week that we are all broadcasting from here, or some of us. So anyway, I see that you wanted to do research in physics, but you said that the draft board said that we needed science and math teachers.
That's correct.
They asked if you would consider working in New York City.
That's correct. So when I graduated, I had an interdisciplinary degree in science, physics, math, and chemistry, and liked physics a lot and wanted to do research in it. And the draft board said, well, you can either teach science and math in New York City, or we're going to hire you to work for us. And I said, okay. And 13 years I stayed in New York City, and I was very fortunate. I had a master teacher teach me how to teach, and I used the skills that Julie Weissler taught me 45 years ago. Now, when I make presentations, when I stand in front of a group, when I meet with a group of people, and he really was a master teacher and taught me how to do this.
So one of the things that I found was interesting about that is you just say it like a nonchalant thing, the draft board. What, I don't know that any of us now would really know what that is. What is that? What is that?
Each area, each region of the country had a group of people who drafted men and women, actually. And what you did was, when you were 18, you registered at the draft board and you received your draft card. When the war started, there was a lottery, and what they did was they put numbers in a big basket, just like Lotto and Powerball happen now, and they picked numbers from there. Before that, everybody was given a number. So if you had a very low number, you had a good chance of being drafted. If you had a very high number, you had a chance of not being drafted. And in addition to that, you had to pass the physical, which I found out years later I would not have passed, because playing football in college, I tore up my ACL. So they wouldn't have taken me anyway.
So that's something that just sounded so different from how things operate today. So it seems like there was not only more direction provided to students in the past, but it was also more acceptable for a student to go along with a guided path. And I feel like today it seems like kids are so pressured to have to shoot for the biggest and the best right out of the gate. And I just feel like that's just too much stress. Just trying to have a little compassion for what young people today have to go through. I know for myself, I knew I wanted to go to college, and my family circumstances didn't make that a given for me. And I was determined to figure out a way to do it. And I was fortunate to find a way to make it happen by attending the College of Insurance and being offered a work-study opportunity. And that gave me the platform to get to where I am today. So I guess I just would like to try to make sure to offer some encouragement to younger people today. You know, if you don't have that crystal clear golden path laid out, don't be discouraged, and don't let other people discourage you. Back to Stephen. So you taught... I
taught science. So I taught English. No. Back up, Stephen. I taught math, general science and photography for about 12 or 13 years. And what's very funny now is every now and then I will be interviewing somebody to work in a medical practitioner's office, and the woman or the man sitting across from me will look at me and say, "Mr. Peltz, don't you remember me?" And it will be a former student. And it throws me for a loop, but it's so nice to see that the kid I thought who was going to die in 6 months after they graduated junior high school has turned out to be a productive member of society.
So one of the other things that I have in the little bio that you gave to me was that while you were teaching, physicians kept asking you business-related questions, and you were able to put it together to them so that they understood it.
Yes, I am a type A personality. And so while I was teaching, I had 2 small businesses going on at the same time. And friends of mine who were physicians kept asking me questions. Now, this is a long, long time ago, Susan. There were no fee schedules. Whatever you billed, you collected. There were no adjustments.
Can I tell you?
For Medicare.
I remember that. I was
You don't
I was
look that
first
old.
starting out. Yes.
You don't look that old.
So I was first starting out. I worked at Metropolitan Life, and it was the very, very beginning of computers and processing claims electronically. And for the most part, you paid what the bill came in as.
Yes, there were no computers when I started, so it was really interesting. And there were also no retirement plans for physicians, dentists, lawyers, accountants, engineers, and 2 other occupations who I can't remember right now. And so they were entitled to have a KEO, which allowed you to put away $2,500. There was also a top tax rate in New York City of almost 70%. So even though physicians and dentists earned lots of money then, they paid tremendous amount of taxes. They didn't have a retirement plan to put money away and shelter it. And so in the mid-70s, New York, Connecticut, and New Jersey passed the PC law, which allowed those same occupations to incorporate and have a real retirement plan. And so the retirement plan that everybody wanted was the standard retirement plan that industry had, which was called a defined benefit plan. And you have to have some math background to understand it. And so I understood it, and I explained it to my friends who were physicians who wanted to have a retirement plan. They then asked me if I would put on a seminar at the local hospital, Flushing Hospital and Medical Center. And I said, "You're nuts. I'm a school teacher." They said, No, you explain it so we understand it, probably because we're just like your students. And so I would explain it to them. And then I'll never forget this. It was a day in January in 1981. It was a Sunday. It was 0 degrees out. I went around picking up my panel because I wasn't going to answer any questions. I was a school teacher. What did I know about business? And so I picked up my panel, and I apologized to all of them as I picked them up, saying, "Who's coming out Sunday morning, 0 degrees out, 9 o'clock in the morning?" And at that time, there was something called a women's auxiliary. You had to pay $25 to come to this. It was called Tax and Financial Planning Strategies for Physicians in the 80s. It was a long time ago. And so I apologized to my panel, and as we're walking in the hospital, there's 250 people there. I couldn't believe it. And so it was supposed to go from 9 to 12. We escaped at 1:30, and a bunch of the doctors gave me their cards saying they wanted to be my client. I had no idea what that meant. No idea what that meant. But clearly, these were business people who were very successful, but didn't know how to put the framework of a business around what they did.
So that's just a great story, and it actually fits in nicely with one of the guests I had last month, who I believe you know. I had Bert Lurch on, and he spoke to us how he got his entrepreneurial start in the business of healthcare. So this is a good place for me to share with the listeners where they can listen to prior broadcasts. So I would suggest that you check out our website at habaneroinc.com and follow the links for radio programming, so you can hear prior interviews, and then you'll also be able to hear this one there too. So let's just get back to Stephen for a minute. And as a reminder, if you'd like to connect with him, you can go to my playlist at wusb.fm, click on playlists, and see the program for July 28th, 2017, and pick up Stephen's contact information. So, Stephen, when I asked you what you'd like to talk about today, that you said you'd like to introduce the idea of helping people understand the business process, help people understand how to identify the steps, discover the disconnects, apply corrective action or training, and monitor the improved process. So it's the owner's or management's responsibility to identify each step in the process, be able to refine it so that each person understands their role and how to plan for, anticipate, react, and correct a disconnect.
Wow, that's pretty good. Can I use that? That sounds great. So what happened was that I went back to a couple of my friends who were the physicians, and I said, listen, can I get a job here? I don't want to get paid, but I have to learn what goes on. And so for a week, I was a telephone operator. A week I was the receptionist. A week I was the biller. A week I was the medical assistant. A week I was the office manager. And I realized that everybody in the office is part of a process, from the person who calls to make the appointment until the check clears. And the information has to go through and be touched by everyone in the process. And if the person in step 2 doesn't know what the person in step 3 is waiting for and doesn't give it to them, the person in step 3 doesn't know what to expect is coming to them. And so a lot of times when they say it falls through the crack, it really means it's a disconnect in the process. It really doesn't matter what your business is. I've been involved working with many non-medical businesses, and the same holds true. There's a process from the beginning of the interaction with the customer until the check clears. What has to happen in order for the customer to be taken care of and to receive what they contacted you for? And it's just amazing to me that once you identify the process and you interview the people in the process, you can identify where the disconnects occur, train them, teach them, work with them so that they understand they're part of this big flow, and then they get the picture and they go forward.
The thing that's most interesting to me is how many people assume on all sides, assume that things should just work. Like, why should I have to explain this? Or why doesn't the next person understand what I'm giving them, or the prior person understand what they have to give to me in order for me to do my piece? All right. So my guest today is Stephen Peltz. And Stephen is with Peltz Practice Management and Consulting Services, and he helps businesses. And today we're talking about medical practices, so we're going to talk about how he helps medical practices just button things up and work more smoothly. So, actually, Stephen, you wanted to do a shout out to some of your students.
Well, not to my students. For anybody who graduated from Jamaica High School or Hillcrest High School, I taught in Junior High School 217, Van Wyck Junior High School in Briarwood, Queens, if anybody many, many years ago has gone there.
What years were those?
Oh, it was before the flood. It was from 1967 to 1979.
All right. So, and now if any of your students wanted to get in touch with you, you have some contact information, or even if people want to talk to you about business processes, what's the best way to reach you?
Well, my website is peltzpracticemanagement.com, all one word.
And that's PELTZ.
Right, peltzpracticemanagement.com. Or they can contact your playlist. Is that have my contact information?
Yeah, so we have phone number and email there. So that's at WUSB.FM, and you can look at playlists.
Right, or if they want, and somebody who will remember it, my email address is the letter S for Stephen, and then my last name, Peltz, Peltz, the numeral 1 at AOL.com. So it's speltz1 at AOL.com.
All right. So we're talking about how to take a medical practice and analyze all the different steps between that patient making that first phone call to the office and getting the check to clear from either the patient or the insurance company, and all the different steps in between. And that's your area of specialty, right? Smoothing that all out?
Yes, and I'm sure that there are probably many people who are listening to this, and maybe some of the people right here, who have gone to their physician's office, checked in, sat in the waiting room, have been called to the exam room, went to the exam room, and sat there, and sat there, and sat there, because nobody's watching the process. So the person who checked you in, put you in the system, and then the medical assistant saw that you're here, has an open exam room, comes to the waiting room, picks you up, brings you into the exam room, asks you some basic questions, puts your chart in the door or enters the information into the computer, and then says the doctor will be right with you. But nobody tells the doctor. An hour later. Or it could be that what happens is that the person who brought you in forgot to tell your clinician that you're there. Or the opposite, if the clinician is working with somebody and is going to be working with them for a long time, then the medical assistant or the nurse should come in and say, listen, Stephen, I'm sorry, Dr. Jones has a case where he's working with a patient, and it will be a little while longer. And once you tell somebody that something's going on and you have informed them of what's going on, it ratchets down their what I call waiting anxiety. Because otherwise you're sitting in the exam room wondering what's going on. When is somebody going to come in to see me? And so that's part of the process, that there was a disconnect. Nobody's watching that, or nobody is aware of the fact that, okay, we've got somebody in there. When is the doctor going to come in? If the doctor can't come in, we should at least tell the person in the exam room, sorry, Dr. Jones has a small emergency in another exam room. He will be another 15 minutes. Sorry about that, but he'll get to you as soon as possible. And then at least you know what's going on. And so you relax, much more so.
And that's just the beginning of the different kinds of things that you find and that can be smoothed out.
Yes. There was about 10 years ago, I had a client who asked me to come in and do what we call an operational audit of the practice. And it requires me to interview everybody and take a look at all of the patient flow and the paper flow and the money flow. And so they said, when will you start? And I said, I will begin tomorrow. And they said, great. I said, it'll take me about 2 days. And they said, wonderful. Just don't interview Elaine. And I said, excuse me? Elaine is our biller, and she works very hard. She doesn't take lunch. She takes vacations by taking an additional Friday in the summer, and we try not to disturb her. So please don't interview her because she doesn't have the time to spare. I said, oh, okay. So the next day I came in. I'm
sorry. Meanwhile, of course, this means you're going to beeline in on Elaine.
You're giving away my lines here. Excuse me. So the next day I come in, and the first person I go to is Elaine. And she has a door to her room, and I knock on it and walk in and close the door. And I say, Elaine, I know that you have been told what I'm here for. And she said, yes. You know what I'm trying to do. I'm not a threat here. I don't fire people. She said, yes. And there's a question in the back of my head that I want to ask Elaine, but I have to get her confidence first. So I said, Elaine, there are 3 doctors here. They see about 20 patients a day each. So that's 60 patients a day. Claims have to be posted into the system. And she said, yes. I said, then when payments come in, those have to be posted into the system. She said, yes. And you do both of those, correct? She said, yes. And then I said, well, when the payments come in, do you tear the checks off of the explanation of benefits? Yes. Do you also fill out the deposit slip? Yes. Do you also go to the bank? And as I'm asking her these questions, her shoulders are going down and down and down, like she says, oh, somebody finally realized what's going on. So I said, Elaine, you can't possibly do all this stuff. She said, well, the doctors have been really good to me, and I don't want to disappoint them. So I only take Fridays in the summer for vacations, and I eat lunch at my desk. And I say, okay, Elaine, so here's the question. What happens when you fall behind? Because I'm sure you do. And she looked at me and nodded her head and said yes. And then she did something. She reached over to her desk, the bottom right drawer, and she pulled it out. And in there was a stack of checks still attached to the EOBs. And I said, what's that? And she said, well, I have so many claims that I have to put into the system and post the payment of. When those checks come in, I post the payment in the system, but I don't have time to tear the check off, fill out the deposit slip, and then I have to go to the bank to make the deposits and then come back. I don't have that time. I said, so what do you do? She said, well, sometimes I'll come in on a Saturday and do that. So I then said, would it be okay just to take a look at how many checks there are? And she said, sure. It was about 2 inches thick, and we quickly totaled it up. It came to about $17,000. I said, okay. I put it back in the drawer, closed the door, and I said, Elaine, would it be okay with you if I asked the doctors if they could hire a part-time person just to post charges? Because they don't need someone with your skills and expertise to do that, or maybe post payments. And what she said was that, I really don't want the doctors to think I don't appreciate what they do and that I can't do my job. I said, Elaine, I'm sure that they will consider this request and not think bad of you. She said, okay, as long as you're sure they're not going to be angry at me. So the end of the first day, I meet with the 3 doctors, and they said, so how did it go? And I said, great. They said, well, who did you meet? And I started off, I said, well, the first person I met with was Elaine. One of the doctors didn't like me there, and he stood up and he screamed at me. And I just sat there, and I let him go on and on and on. And then finally he stopped. And when he stopped, I said, okay, come with me. And I took the 3 of them into Elaine's room. I opened up the drawer. And I said, now you're never to tell Elaine that I'm showing you this. And I took out all the checks and put them on the desk. And they said, what is that? And then I explained it to them. I said, there's $17,000 here. This poor woman doesn't have the time to tear the checks, fill out the deposit slip, run to the bank, and she doesn't want you to think less of her. And so they looked aghast. They said, what should we do? I said, well, you should allow me to tell her that it's okay to hire a part-time person just to do some of the rote stuff, like entering the stuff into the system, which she, with all her skills and expertise, doesn't need to do. But don't tell her that I brought you in here and showed you this. And they said, okay. So we put the checks back in the drawer, closed the drawer, left the room. And the next morning I walked into Elaine's office and I said, Elaine, guess what? It's okay to hire a part-time person to either post payments or post charges, which will free up a lot of your time to do the things that someone with your skills and expertise can do. And she looked at me and she almost started to cry. She said, oh, thank you so much. Do you think the doctors are angry at me? I said, nope, the doctors are very happy to do this. So there's, again, these 3 physicians had very successful businesses, but they don't know how to put the framework of a business around what they're doing and see what's going on. And that's where somebody like me, who's an anal retentive, who comes in and asks questions on and on and on, do my work.
It's interesting because, so for our listeners who might not know, Stephen and I have worked on quite a few projects together. And while that story might have sounded a little overly dramatic, we see it every day. And what happens is, I think, is you get so caught up in the bigger picture of things that it's also impossible. It's impossible for any manager or owner of a company or the doctor in a practice to be able to be intimately familiar with every step of minutia that goes on. So, and a lot of times the people that are doing that work don't have the communication skills to effectively tell you what they need or what they need help with.
I was recently called into a hardware support company, and they said, we have a very good business here. It keeps growing, but we don't know what's going on. And we think there's some problems. So I went in and did my analysis, and I found out that when people call up for support, a ticket is created, an electronic ticket, and the electronic ticket says who called, their contact information, and what the information is about the problem that they're having. And then it goes into this never, never land where they're hoping somebody who supplies the help desk work or a technical person can pick up the ticket, contact the client, and walk them through how to resolve the problem. But nobody looks at the process. And so after they create these tickets, it goes out there, and sometimes it's immediately resolved and they contact the client. Or it could sit there for 3, 4, 5 days, and the client gets more and more angry because nobody's looking at the process.
Yeah, it's amazing. So, we've worked together on a couple. Don't start laughing. But we've worked with practices where the person who's hired us is the visionary, and he or she knows exactly what the potential is of the practice, and they're excited. They have a great thing going on, and they want some help buttoning things up and helping to crank it up to the next level. And that was a very exciting project that we worked on together.
And so I used to have a partner, and he and I were a perfect fit because he was the visionary and I was the grunt. He would create the outline of the canvas, and I would be responsible for filling it in. And so the idea is, if you have a visionary as a boss, you better make sure you have a lot of good grunts there.
Yeah. And we've also had clients who thought they wanted to take things to the next level and didn't appreciate how far they needed to go, or how much work was needed to fine-tune the foundation that they already had in order to be able to take that next step. So that's one of the things that I find is the biggest challenge, is to figure out where is each practice. I work pretty much with medical practices. Where are they starting from? Are they at the point where they want to be able to increase the business in their practice, or are they already so overloaded, and maybe what they need to do is figure out how to fine-tune the patients or services or payers that they're going to be working with. So I think that's probably the first important thing. One of the things I find is people ask you for something, and a lot of times that's not really what they need.
No, it's not. And people who run businesses are sure that they know the answer to the question. I work really well with people who know what they don't know. If somebody doesn't know what they don't know, then they're going to assume that they know everything that needs to be known, and they're not going to listen to me anyway. So I'd rather part on good terms. I started my business in the late 70s, early 80s by putting physicians in practice. And one of the first practices we opened was in Manhattan, and it was 2 internists. And we did all of the background work. We got the loans. We got the contractor. We helped with the design of the exam rooms, the equipment that was necessary. And then they opened the door. And when you open the door in any business, there may not be a whole line of people waiting to buy your product or service. And so late in the day, I went to their office, and it was empty. The staff was gone. The 2 physicians were sitting there in the waiting room, and they had shelves where they put the charts. This was before computers. And there was one chart there, and there was a fan, and the fan would go back and forth, and the chart would sometimes blow to the left and sometimes to the right. And I said, "What are you doing?" They said, "You see those shelves? Those shelves are going to be filled with charts. Right now we only have 1. but at some point they're going to be filled with charts. And they were both visionaries. They knew it was going to work.
Yeah. So I am going to wrap this up. And Stephen, I would like to thank you for coming in today and talking to us here at the Business of Healthcare. It is 1:50 on a Friday afternoon. It's Friday, July 28th, 2017, and you're listening to WUSB Stony Brook. And my guest today has been Stephen Peltz, and he is, I have to ask you, CHBC is...
4 letters.
Yes, and it stands for? It
stands for Certified Healthcare Business Consultants.
All right.
I am a member of that society. There's about 250 of us around the country, and we have expertise in different areas. And sometimes when I'll get a client who will call me from Oregon or Colorado or Virginia, and I will make the initial contact, I will look to see if I have a colleague in that area, and the colleague will be the on-site person for that business, and we will work together that way.
Interesting. So, you and I also wanted to talk about, if anybody wants to contact Stephen, you can check out his website. It's peltzpracticemanagement.com, or you can check the playlist at wusb.fm, and that will give you additional contact information for him. You can listen to recordings of this and prior healthcare-related broadcasts by going to my website. That's www.habaneroinc.com and click on Radio Programming. You can also contact me if you've got questions about this program or suggestions for future program topics at 631-244-5661, or you can send me an email here at the studio, habanero@wusb.fm. Now, another thing that I wanted to touch base with quickly, Stephen, is one of the things that I think is important for all of us that work with medical practices, I mean anyone who's in business, but particularly for us, is being able to connect with other people who work with medical practices.
That's correct, because I know what I know and I know what I don't know. And so I have a Bible of business cards, and I have come to your group meetings where we have people who have specific businesses that provide products and services to support medical practices and other businesses. So I need people who with expertise in computers, in supplies, in staffing, in payroll, in architecture, designing offices, in medical practice equipment. And so it's important to have a network of people who you know, because when somebody asks me a question, I say, well, I either will know the answer to it or I will know where to get the answer. And that's my definition of a good consultant, because you can't know everything, and you shouldn't tell somebody that you know everything.
So if anyone's interested in finding out more about that group, it's called Healthcare Introductions, and there's a bunch of us, and we meet every month for a breakfast meeting, and we'd love to have you join us. So you can get in touch with us for that. And Stephen, I just want to thank you again so much for coming on the air with me today.
Well, it's been my pleasure, and leaving, I just want everybody to understand that this will be the year that the Giants go back to the Super Bowl.